The Domestic and Family Violence Risk Assessment and Management Framework, or RAMF, is one of the Northern Territory Government's key reforms to increase safety for women and children experiencing domestic and family violence under the 10-year Domestic Family Sexual Violence Reduction Framework, Safe, Respected and Free from Violence. The RAMF encompasses evidence-based information and resources that help workers to identify domestic and family violence, to assess domestic and family violence risk, and to respond to domestic and family violence risk. This video provides an overview of the RAMF and helps services and workers understand their different roles and responsibilities under the RAMF. For people seeking help from domestic and family violence, the pathways are not always clear or consistent. Responses are different across service providers. They may use different terminology, different tools, frameworks, and processes. The RAMF was developed to unify the approach to domestic and family violence risk assessment and management across the Northern Territory. A consistent understanding, language and approach to respond to domestic and family violence risk will help identify domestic and family violence as early as possible and enable services to work together more effectively so that people get the help they need. The RAMF and Common Risk Assessment Tool, or CRAT, were developed following a comprehensive consultation process with stakeholders, including Aboriginal community-controlled organisations, non-government organisations, peak bodies, the police, legal services, government agencies and workers in domestic and family violence specialist and universal services across the NT. Feedback from consultations was incorporated with the latest evidence from the Northern Territory, Australia and internationally. This included anti-coronial inquests, the Family Safety Framework Review, ANRO's Domestic and Family Violence National Risk Assessment Principles, and the Australian Domestic and Family Violence Death Review Network data. Many of you were involved in RAMF, CRAT and training development. Thank you for sharing your time and expertise with us. The RAMF is a part of the Domestic and Family Violence Act. It is related to the Domestic and Family Violence Information Sharing Scheme, which was established in 2019 to allow information sharing entities, or ISEs, to safely share relevant information to prevent, assess and manage serious threats of domestic and family violence. For information sharing entities, aligning with the RAMF is a legal requirement under the Act. Information sharing entities must align their policies, procedures, practice guidance and tools with the RAMF. Government agencies that are prescribed as information sharing entities under the Act include the Department of Territory Families, Housing and Communities, Health, Education, Department of Attorney General and Justice including anti-corrections, anti-police and courts. Any other entity that provides a domestic and family violence related service can apply to become an information sharing entity and be prescribed by regulation. More information, including online training of the Domestic and Family Violence Information Sharing Scheme, is available on the Territory Families, Housing and Communities website. The RAMF has 5 components. 1. A common understanding around what domestic and family violence is. 2. A consistent and evidence-based approach. 3. A coordinated and collaborative and integrated service system. 4. A strong legislative foundation, and 5, and most importantly, a supported, safe and capable workforce who have the skills and training they need to respond to domestic and family violence, and the support to work safely and effectively. Without this, none of the other components would be possible. The RAMF comprises 3 parts. Part A is the introduction, and it explains what the RAMF is and why it was developed, who the RAMF is for, and how the RAMF can work for you and your service. Part B outlines a common understanding and definition of domestic and family violence, including sexual violence in a domestic and family violence context, the importance of understanding coercive control, the prevalence of domestic and family violence in the Northern Territory, and the evidence base on high-risk factors. Part C provides 7 practice guides for workers. The first 3 provide practice direction on each stage of the risk management process, and the remaining 4 practice guides provide practice direction on record keeping, referrals, worker safety, mandatory reporting, and information sharing. Within the practice guides, there are 9 tools, including the Safety Planning Tool, the Screening Tool, and the Common Risk Assessment Tool. The Common Risk Assessment Tool, or CRAT, is a part of the RAMF. The CRAT is an evidence-based tool which is used to assess the risk for harm for a domestic and family violence victim survivor. The Common Risk Assessment Tool reflects current evidence in domestic and family violence risk assessment, particularly in relation to high risk factors that haven't previously been captured in our risk assessment tools. These include an emphasis on seeing domestic and family violence as a pattern of behaviour rather than a series of one-off incidents, understanding coercive control, speaking up about sexual violence, and listening to the victim survivor's own assessment of their risk. Territory families, housing and communities worked closely with the NT police and specialists to develop and test the Common Risk Assessment tool. Once completed, the Common Risk Assessment tool provides an assessed level of risk and recommended actions to respond. The Common Risk Assessment tool is only to be completed by specialists and statutory workers who have the skills, time and training to perform this task. The Common Risk Assessment tool is also used to refer cases assessed as at serious risks to the Family Safety Framework where this operates. The Common Risk Assessment tool replaces the Family Safety Framework Risk Assessment tool. All referrals to the Family Safety Framework must now be made with the Common Risk Assessment tool. Under the Common Risk Assessment tool, the threshold of high risk for referrals to the Family Safety Framework is now known as serious risk. Victim survivors should receive a consistent response regardless of where they enter the service system. The services who work with domestic and family violence victim survivors in a Northern Territory can be divided into 3 groups. The first group, statutory services such as courts, child protection, police, youth justice, corrections or mental health. They may not see themselves as providing domestic and family violence services, but a lot of the work they do, maybe even the majority, is in fact with people who have experienced or committed domestic and family violence. The second group are the specialist services like women's refuges and safe houses, men's behaviour change programs, and family violence legal services whose core business is responding to domestic and family violence. The final group are universal services or generalist services like health clinics, night patrols, schools, and general practitioners. These services are the most likely to first encounter victim survivors or people who have committed domestic and family violence as a part of their work, even though it is not their core business. Under the RAMF, every worker has a shared responsibility to respond to domestic and family violence, even if it is not their core business. However, that responsibility is different depending on their role, the function of the services they work for, and the skill and the experience of the worker. Identifying if domestic and family violence is occurring is the fundamental first step. Workers in universal, specialist, and statutory services all have a duty to undertake screening for domestic and family violence. This is an important role to play in identifying people early and referring them on to get the support they need. If domestic and family violence is identified or suspected, universal services will then refer to specialists and statutory services who have the skills and time to undertake a risk assessment. Universal services and workers also have responsibilities such as mandatory reporting or, if it is an emergency situation, immediate risk management such as calling the police. Comprehensive and ongoing domestic and family violence risk management is usually led by specialist services, with statutory services playing a key role. This process is important so that victim survivors are responded to at each stage by the workers who are most qualified and able to help them, and so that these services and workers are clear about their roles. So where do Family Safety Framework members fit in? They fit into the specialist category. This is because while they may work for a specialist, universal or statutory service usually, when they are sitting on the Family Safety Framework, they are performing a specialist role in assessing and responding to risk. For information sharing entities, aligning with the RAMF is a legal requirement under the Act. Non-information sharing entities are not required to align with the RAMF. However, all services are strongly encouraged to align their policies, procedures, practice guidance and tools with the RAMF. This is because the RAMF is intended to guide and support all services to better identify and respond to domestic and family violence risk. There are many benefits in aligning with the RAMF. The earlier we identify domestic and family violence, the more chance we have of preventing the escalation of violence. It is likely that domestic and family violence victim survivors are already using your services. The RAMF will help you identify them so that their safety can be supported. Aligning your processes with the RAMF will give staff the training, skills and confidence to be able to identify, assess and respond to domestic and family violence. Consistent and collaborative practice across all organisations will help provide a more seamless response. And finally, domestic and family violence affects our staff, colleagues and peers as well as our clients. They may also be victim survivors. The RAMF means that our workforce, as well as our service users, can feel supported for their own well-being and safety. We understand that alignment with the RAMF is a significant task, and the way it is implemented will be different for every organisation. Resources and tools to help your organisation align with the RAMF are available on the Territory Families Housing and Communities website. These resources include the RAMP itself, the 7 practice guides and the 9 practice tools, a frequently asked questions handout, and an implementation guide for organisational leaders, this orientation video and training workshops on using the RAMP, which is available for all staff. There may be a number of questions you are now considering. The RAMF Organisational Implementation Guide goes through these questions in detail, and it is a useful tool for leaders, managers and boards. To find out more, you can visit the website tfhc.nt.gov.au/DFV/RAMF or get in touch via phone or email. Thank you for taking the time to learn more about the RAMF. Domestic and family violence is preventable. With concerted, collaborative and long-term efforts, we can all work towards our shared vision where all Territorians are safe, respected and free from violence.